Board of Health meeting for this term of council. Bonjour, Kwe. Thank you all for being here for the last meeting. I would like to begin the meeting by honoring the Algonquin and Anishinaabe Nation, land and people. Ottawa is located on unceded territory of the Algonquin and Anishinaabe Nation and is a gathering place for many Indigenous people. On behalf of the Board of Health and everyone in Ottawa Public Health, I would like to honor the land and the peoples of the Algonquin and Anishinaabe Nation, whose ancestors have lived on this territory for millennia, and whose culture and presence have nurtured and continue to nurture this land. I'd like to extend that honor to all First Nations, Inuit, Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. So just a couple of reminders before we get into the substance of the meeting. Anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. Please avoid using speakerphone when speaking. Please speak directly into your device's microphone or your telephone receiver. Now, for this room, we're going to be using the mics that are in front of you, but the people on Zoom obviously would be participating in that fashion. For those participating in person, please keep your laptop or mobile device on mute and use the tabletop microphones when speaking. I'm going to ask the board secretary to conduct roll call.
Member Banham. Member Coutier. Member El-Shantiri. Matt, can you check the mics? They're not working. Member Gower.
Here.
Member Kavanaugh. Here. Member Lakin. Member Menard.
Present.
Member Pinel.
Présent.
Merci. Member Tilley.
Present.
Vice Chair Di Giovanni.
Present.
Chair Eglay.
Here.
We have quorum, Mr. Chair.
Thank you. We have no regrets. I'm now going to go over some of the procedures for the Zoom meeting. Should members participating via Zoom need to leave the meeting, they should advise verbally that they're doing so before clicking on leave meeting from the Zoom platform or ending their call if participating by phone. In terms of speaking order and process for speaking, I'll provide each member with the opportunity to ask questions or comment. Members will be called upon to speak in the order or reverse order as set out in the board secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on any given matter, you may decline verbally when your name is called. If a full recorded vote is not taken for a given item, I will specifically ask if the item is carried, and then call for dissents to ensure that all votes are properly registered. Points of order, privilege, or challenge, procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Should technical difficulties or other unforeseen matters require recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. Are there any declarations of interest? Okay, seeing none. I'll ask for confirmation in the minutes of the meeting of September the 19th, 2022. Confirmed? Thank you. We have 5 communication items that have been received and held on file with the Board of Health Secretary. I'm going to ask Member Cloutier to please move the motion to introduce reports.
Either that or speak on
Be it resolved that the chair of the board, urban health report, the medical officer of health urban report, the reports titled Ottawa Public Health Submission to the Government of Canada on cannabis legislation and regulation in Canada, Ontario Public Health Standards 2022 activity reports, risk management, Le ministère de la Santé de l'Ontario, responsabilité et diligence de déclaration, le rapport d'activité standard du deuxième trimestre 2022, le plan stratégique de santé publique Ottawa pour 2017-2028, troisième trimestre 2022, à Ottawa, plus 5, plan stratégique de santé publique Ottawa 2019-2022, rapport final soit reçu et examiné.
Thank you, carried. Okay, we'll now go through the usual consent agenda process. Sorry, my video went out. For those participating or watching from home who may not be familiar with this process, I will list each of the items agenda. And for any items where board members don't have questions or concerns, and we don't have public delegations, registered to speak, the board may carry or receive those items on consent, which is to say without any discussion. So I'll go through consent agenda. I think somebody is not muted because we're getting some feedback. So if you're here, you should, your Zoom. Okay, thank you. I still have some people that are not muted. Okay, we'll try again. No, we're still getting a little bit of feedback, but we'll go ahead. So the first item is my verbal report. We'll hold that. The next is Dr. Etch's verbal report, and we have 2 public delegations, so we'll hold that as well. Number 3 on the health submission to the Government of Canada on cannabis legalization and regulations in Canada. Is that carried? Carried, thank you. Number 4, Ontario Public Health Standards 2022 Activity Reports Risk Management. Received? Thank you. Number 5, Ontario Ministry of Health Accountability and Reporting Requirements Q2 2022 Standard Activity Report. Received? Thank you. Number 6, Ottawa Public Health Strategic Plan for 2019 to 2022. Update from Q3 of 2022. Received? Thank you. Number 7, Building a Healthier Ottawa, Ottawa Public Health Strategic Plan 2019 to 2022, End of Term Report. Received? Thank you. The agenda also lists 1 information previously distributed memo circulated to board members in advance of the agenda, entitled Monitoring Food Affordability in Ottawa, 2022 Nutritious Food Basket. Just a reminder that IPD memos that are not on the agenda for consideration discussion, lifting an IPD for consideration or discussion at this meeting will require suspension of the rules by a vote of 3/4 of board members present and voting. Does anyone wish to lift an IPD for consideration or discussion at today's meeting? Okay, thank you. We'll now go back to the first held item, which is my verbal report. So we'll now go to my report. And so this is, as I said, the last meeting of this term, and I'd like to take this opportunity to express my appreciation to Dr. Etches and the entire team at Ottawa Public Health for their hard work, dedication, and professionalism in everything that they do. This has been 4 years like nobody could have possibly anticipated, and the team has just been absolutely amazing. As chair, I've had a front row seat these past 4 years, not only to watch the pandemic unfold, as so many of us have, but also to see how Dr. Etches and the OPH team have responded, and a privileged opportunity to understand why. While the public health team has always done great work to promote wellness and protect the health of our community, to collect data, collaborate with partners, and share information, The pandemic brought new challenges and new opportunities. And without fail, the team has faced it with ingenuity, professionalism, thoughtfulness, kindness, empathy, and compassion. I'd also like to thank you, my board colleagues. We've used the word unprecedented a lot in the last few years, but it really has been unprecedented. When we took on these roles in late 2018, early 2019, none of us could have predicted what we would all be facing together. So thank you for sticking with us for the full term. I know it always hasn't been easy to do. But thank you for your willingness to pivot to virtual meetings. Thank you also for your insights, your guidance, your leadership, and support these last 4 years. With the new term of council beginning next week, I'd like to offer my sincere congratulations and best wishes to Mayor-elect Sutcliffe and to all the newly elected and re-elected members of council, several of which sit around our board. I wish them a productive and cordial term. I also want to congratulate all the candidates who put their names forward in this municipal election. It takes a lot of courage, as well as a lot of time, energy, family, and community support to do that. And they all deserve our respect and congratulations for putting themselves out there and being prepared to serve our community. Finally, I'd like to remind everyone that flu season is now upon us and has been noted, we have and will continue to have multiple respiratory illnesses circulating concurrently in the community this fall and winter, including COVID-19, RSV, and influenza. As of November 1st, the general population is eligible for the flu shot, which most people can access through their primary care provider or a local pharmacy. I encourage everyone to book their flu shot as soon as possible. OPH's flu immunization campaign will focus on providing access to children aged 6 months to 2 years and their household members, as well as to newcomers and individuals without OHIP who are unable to access a flu vaccine through a primary care provider or pharmacy. My one regret from the past 4 years of chairing this amazing board is that I cannot report at our final meeting that COVID is over and done. Unfortunately, despite everyone's best efforts, it is still in our community doing harm. Having said that, there are still things that we can all do to minimize its impact and to protect ourselves, our families, neighbors, and friends. As we enter the fall and winter season with COVID, flu, and RSV in our community, we can wash our hands, get vaccinated, wear a mask while at indoor events or activities such as shopping or using transit. We can stay home when not well. These are all actions within our control, all things that we can do to support our community and our healthcare system. This city has exhibited such care and concern for one another. We can continue to do so and work together to minimize these negative impacts of the viruses in our community. And this concludes my verbal report. Thank you. Can we accept the verbal report? Thank you. And, questions, sorry.
Not a question, but also thank you, Chair, as you depart, since you're decided not to run again, and appreciate what you've gone through in the last 4 years, because I think if someone had told you, maybe you wouldn't have ran as chair, but it's been over and above. So thank you for your hard work as well.
Thank you very much. I appreciate that. I'm now going to call on Dr. Etches to give her verbal report, after which we'll have a number of delegations. Thank you.
Right, so good afternoon, Kwe, Unisakut, Tanshe, Annie, bonjour. It is lovely to be able to thank many of you in person and to see you online. So today I will spend a little bit of time talking about the respiratory season as we head into winter, as well as provide updates on other public health work aimed at improving the health of children and all people in Ottawa. So I am strongly recommending mask use indoors, in confined spaces, and in crowded settings, given the extraordinary respiratory viral season that is upon us and ahead of us. While I see some people wearing masks indoors, there is room for improvement to reduce the level of spread of respiratory viruses in our community and to keep our healthcare system working. Adults can be examples for children and youth, and I'm seeking to foster a greater understanding, to build awareness about why I'm promoting a return to masking now. Our COVID-19 monitoring indicators are telling us that the wastewater virus detection levels are high. The percent of people eligible for testing that turn out positive is high, is very high. And then the lagging indicators that show up later, the COVID hospitalizations and newly confirmed outbreaks are currently moderate. So in summary, the levels of COVID in our community are remaining high. As the chair mentioned, we confirmed our first influenza outbreak here in Ottawa about a month earlier than usual. And last week marked the start of the influenza season in Ottawa. The percent again of people testing positive has gone up very steeply over the last week. Ottawa has also seen increasing respiratory syncytial virus activity, RSV virus, we call it. And that's particularly among children. And the presence of all these viruses at high levels at once is what makes this year exceptional. It's different from just COVID in the previous 2 seasons, and it's different from before COVID when influenza and RSV might not have come at the same time like this. We are monitoring illness as well in schools and childcare centers, and in the past several weeks, we've seen absenteeism grow in childcare and school settings along the same lines as in community measures. Many of the absenteeism reported, much of it is due to respiratory illness. And so we're continuing to work with these partners, school boards, childcare providers, to mitigate the spread and review infection prevention and control measures. With the return of cooler weather, it is important that people continue to use the layers of protection against COVID-19. And so for COVID and influenza, that first layer of protection is being up to date on your immunizations. And other measures to help protect against all respiratory viruses include staying home when you're sick, wearing a mask indoors and in crowded spaces, and good hand hygiene. That these will also protect against the other kinds of respiratory illnesses. Ensuring that children have the urgent care they need is critical. And ensuring that children have what they need for healthy development now and into the future, these are priorities for the health of our population into the future. So I'll speak next about a couple of other efforts for promoting healthy development that have happened recently during October. That's Children's Vision Month. Ottawa Public Health did a series of social media posts supported by an advertising campaign on social media that was intended for parents and guardians of youth. The campaign's goal was to promote an understanding about the importance of visual health. En octobre 2022, à l'occasion du mois de la vision des enfants, Santé publique Ottawa a réalisé une série de messages sur les médias sociaux et soutenu par une campagne publicitaire destinée aux parents et aux tuteurs des jeunes. L'objectif de la publicité était d'informer le public sur l'importance de la santé visuelle. Vision issues can lead to learning difficulties, such as problems with seeing the teacher in class and injuries. It can lead to poor performance when playing sports, lower self-esteem, and many other things. So this campaign is encouraging parents and guardians and youth to visit their local optometrist for an annual eye exam, which is free. Further, we in October launched a new Vision Health webpage and had a host in our Parenting in Ottawa Facebook page, Dr. Joshua Smith, a local optometrist, promote vision health. All schools with junior and senior kindergarten have received cards promoting these visits to optometrists, and Ottawa Public Health will be further promoting vision screening in neighborhoods that face greater barriers to health, including through reminder cards. So just turning to a second subject for children's health, Just as COVID-19 and influenza vaccines are key tools to getting through the respiratory illness season, so too are other childhood vaccines important to avoid outbreaks and serious illness from viruses like measles, mumps, and whooping cough or pertussis. And so since our last meeting where we discussed the need to catch up on childhood vaccinations, Ottawa Public Health has been actively working with partners, including Kids Come First, many other community partners to explore options for more access to routine childhood vaccinations. Depuis notre dernière réunion, Santé publique Ottawa a travaillé activement avec ses partenaires, notamment les enfants avant tout et de nombreux autres partenaires communautaires afin d'explorer les possibilités d'accès à la vaccination des enfants. So we are working up different ideas that will include serving residents who again have greater barriers to immunization, such as lack of OHIP or a lack of a primary care provider. And also following discussion at our last board meeting, Ottawa Public Health's feedback on the federal approach to cannabis was circulated to you. And I know you just carried that on the agenda tonight, so thank you. A key goal of our recommendations was to strengthen the regulatory approach to decrease emergency room visits and hospitalizations of children. Additionally, there were other recommendations being put forward related to regulations that would protect the health and safety of people across the lifespan while continuing to provide access to regulated sources of cannabis. Also important for children, poverty can create significant challenges for children's well-being. And so Ottawa Public Health continues to highlight the need for people to have adequate incomes to meet their basic needs. Ottawa Public Health has been monitoring the cost of healthy eating in Ottawa on an annual basis, with certainly the exception of 2020 and 2022-21, when we were fully occupied with the pandemic response. This data was collected again in 2022, this year, using the nutritious food basket survey tool. And it's a standardized tool that is used to monitor affordability and accessibility of food in our city. And it relates the cost of the food basket to individual household incomes in different scenarios. So, for example, we found out in 2022, it costs at least $1,088 per month to feed a family of 4 with 2 adults and 2 children, where one of them is a teenager, a basic healthy diet in Ottawa. This is a significant jump from 2019. The results of the nutritious food basket over the years have consistently shown that individuals and families living on fixed incomes or low incomes do not have enough money left at the end of the month to afford their bills, while also putting healthy food on the table. Au fil des ans, les résultats du panier à provision nutritive ont constamment montré que les personnes et les familles à revenu fixe ou à faible revenu n'ont pas assez d'argent à la fin du mois pour payer leurs factures et tout en mettant des aliments sains sur la table. So for more information on this year's results and food insecurity in general in Ottawa, please sign up for our webinar, which we'll be hosting on November 23rd from 1:30 to 2:30, or spread the word that registration's available on our website. It's ottawapublichealth.ca/food insecurity. So in collaboration with city and community partners, our neighborhood health and wellness hubs have expanded again, now to 15 locations across the city, to continue delivering more integrated services closer to where people live. En collaboration avec nos partenaires de la ville et de la communauté, nos centres de santé et de bien-être de quartier ont été entendus à 15 sites à travers la ville afin de continuer à fournir des services intégrés plus proches des lieux où les gens vivent. So we're continuing to use a quality improvement lens and evidence-based, community-informed and data-driven approach when considering adjustments to services and service locations. The services and the promotional approaches and locations are adjusted based on uptake, demographic data, and feedback from the community. Flu vaccines are now available in all hubs, and work is underway to assess, again, the feedback to ensure that we continue to make sure we have the right services in the right locations. We hope that the hubs will continue to promote and protect the health and well-being of people in Ottawa. And so I am going to finish by saying I have been reflecting on how you as board members have shaped our work over the last 4 years, creating the overall guiding strategy and policy approach for us. You pushed us to provide more regular updating on measures. You oriented us towards more equity-focused work and strengthening reconciliation actions, including, for example, these neighborhood hubs. You've supported our work throughout the pandemic, including making space for people to share diverse views in this forum at board meetings. And you've guided us in our communications with the province. So thank you for the time that you put in to read reports, ask questions, set priorities, and put forward motions. Merci pour le temps que vous avez vous consacrez à lire les rapports, à poser des questions et à réfléchir aux priorités. I'm sure that our next board's work will build upon what you have done. And I do have to thank you specifically, Chair Eglai and Rachel, Hannah, for the countless hours that you have given. Really, you were motivated to make sure people had the information, elected officials had the information they needed to make good decisions, and certainly through some very stressful times. So that concludes my report, and I'm happy to answer any questions. Merci, Nakomik. Thank you, Miigwech.
Thank you, Dr. Etches. Before we go to questions, we have two things to deal with. We have two public delegations that will be joining us via Zoom. But before that, I'm going to ask the Vice Chair to introduce a motion. So that can be on the table for you to consider as you hear from the delegations, and you can also consider what questions you might have for Dr. Etches. So Vice Chair, can you introduce the motion, please?
Thank you, Chair. Whereas at its meeting of November 7th, 2022, the Ottawa Board of Health received an update from Ottawa's Medical Officer of Health with respect to local COVID-19 rates that continue to be high. And whereas the Medical Officer of Health also noted that other respiratory viruses are circulating concurrently, such as influenza and RSV, which contribute to the significant pressures felt by local hospitals. And whereas healthcare providers at CHEO in particular have flagged unprecedented volumes of infants and children with respiratory symptoms from various viruses challenging the provision of care. And whereas Ontario's Chief Medical Officer of Health has also recently publicly expressed concerns that the health system will see a triple threat of COVID-19, a bad influenza season, and the resurgence of RSV in children this fall and winter, stressed the importance of vaccination and suggested that mask mandates could be brought back in order to help control transmission of respiratory illnesses. Therefore, be it resolved that the Chair of the Board of Health write to the Premier of Ontario, the Minister of Health, and Ontario's Chief Medical Officer of Health to request that the Ministry of Health publicly release information on data and projections for this fall and winter's respiratory illness season and the impact it could have on the public's health and our healthcare system so that residents can better understand the risks and rationale for starting to wear masks again and to protect themselves and their loved ones and to maintain access to critical care through this exceptional respiratory season. And that the Ministry of Health intensify the visibility and reach of a mass health communications campaign to explain the benefits of COVID-19 and the flu vaccination and masking, and to strongly encourage their use. And the provincial messaging include information about other measures for limiting the impact of respiratory illnesses on our healthcare system, such as staying home when sick and how to access treatment, such as Paxlovid, for those at greatest risk.
Thank you very much for introducing that, and we'll deal with that after the delegations and questions to Dr. Etches. Our first delegation with us is Dr. Lindy Sampson from CHEO. Thank you very much for joining us tonight, and I'll turn the mic over to you.
Thank you very much, and good afternoon, everyone. My name is Lindy Sampson. I'm a pediatrician and I'm an infectious disease specialist, and I'm the Chief of Staff and Chief Medical Officer at CHEO, where I've been since the 1990s. And I'm here speaking to you this evening because the number of children of our community in Ottawa needing to come to CHEO for care in our emergency department or be admitted to hospital, to our inpatient units, or even into our intensive care units is higher than it's ever been. And the overwhelming majority of those children are coming to care because they're having difficulties breathing or having fever or having challenges because of viral respiratory infections. I've never seen it like this before, and I'm really worried. So I'm here today to sort of paint the picture of what we're seeing and to ask for our community's help and support so that kids in our community that need our care can get the care that they need. So we're seeing more kids than ever before coming to CHEO for care. And right now, the overwhelming majority are from viral infections. And we're used to seeing RSV infections. We're used to seeing influenza infections. And in the past 2 years, we've become used to seeing COVID infections. And what's happening right now is they're all coming together in almost a perfect storm. And so we're seeing a big surge in RSV. We're seeing a surge in influenza start, and we're still seeing many kids admitted to our hospital because of COVID and other viral infections. On Sunday, yesterday, we had 250 children come to our emergency department needing care. And that's an emergency department that's really set up to see 150 children a day. At this morning, when we came in to sort of start our week, we had 10 children who required admission to our hospital, most of whom because they were having difficulty breathing. Stuck in our emergency department because we simply did not have an available bed for them to move up to. They were receiving the care they needed in our emergency department, but it was certainly less than optimal. Today, our inpatient medical team, our inpatient medical service broke another record, a record that we don't want to break because there were more than double the number of children admitted to our medical wards than we would normally see or than we're set up to see. And again, the overwhelming majority were admitted with viral infections. And our pediatric intensive care unit, which is where the sickest children go, most of whom need help with their breathing or with supporting the amount of oxygen in their blood, was at 186% occupancy. And what that meant is we were having to postpone significant surgeries that require intensive care afterwards. And at times that has even meant that children needing that degree of care, children from Ottawa are being sent outside of our region several hours away to the next available pediatric intensive care unit bed. We are all hands down deck. We are doing everything we can to help manage this. We're preparing to open another intensive care unit. We are moving any staff with clinical frontline experience to those areas that are most in need, that need our help. We're quickly hiring more staff and getting them out and working on the floors. We're continuing to work with community partners to help support other options in the community for kids that might be less sick that can get care elsewhere. And we're started our enhanced viral season measures that we do every year to try and keep those as much of the viral infections that are in the community out of the hospital as much as possible by reducing the number of people that are coming into the building. But I'm here today for another reason, because it's not okay for a family to wait 20 hours in the emergency department before they see a physician. It's not okay for a baby who needs help with their breathing because of a viral infection to wait up to 48 hours in our emergency department before getting a bed in a unit. It's not okay for our nurses to extend shifts, to pick up extra shifts again and again and still have us be in an emergency situation. It's not okay for our doctors to have to choose between which children that both require urgent surgeries can be done on a single day because we simply only have room for one. And it's not okay for children and youth awaiting surgeries and clinic appointments to have them postponed because we've had to reassign staff and pool resources for those that are most sick. So while we're doing everything we can, it's not enough. And we're here today because we're asking for our community, the community of Ottawa, which has really always rallied around kids, that if we care about our kids and we want our kids that need healthcare to be able to get the care they need when they need it in a timely fashion, where they need it, so they don't need to be sent out of the region, and as quickly as possible, we all need to step up and rally behind them. And so what we are asking today is for our great community to put our masks back on. Whenever we're in a crowded indoor space, including schools, it's time to put our masks back on. Please wash our hands. Please do all the things that we know work. And of course, stay home when you're sick and get all the vaccines that you need and you're eligible for, including your next COVID vaccine, as well as your annual influenza vaccine as soon as you can. We know that all of these things work, and this is the time for our community to come together to support our kids and our ability for them to get the healthcare that they need when they need it. So with that, I thank you, and I'm happy to answer any questions.
Thank you very much, Dr. Sampson, for coming today. And it's unfortunate news that you have to share, that you had to share with us, but I think it's important that you were here and were able to do that. I'm just going to run through the board members to see if anyone has any questions for you, Dr. Sampson. So we'll start with Member Tilley.
No, thank you for the presentation.
Thank you. Member Pennell.
No, but thank you so much for all you do and for the presentation.
Member Menard.
No, thank you, Chair. Thanks for the presentation.
Thank you. Member Lakin.
Thanks, Chair. I do have one question for the presenter. If she has a sense of whether there are particular environments where the community putting their mask back on would be of greatest impact.
Thank you for the question. And I think one thing that we have learned over the past 2 years is that masks actually help and work to help stop the spread of viruses. So, I think we need to get back to the principles that we know work, and that's in any crowded indoor space when we cannot maintain physical distancing, whether it's the grocery store, whether it's our work environments, whether it's gatherings that we're having with family, friends, and also including in our school environments.
Thank you.
Member Kavanaugh.
Thank you very much. My question is, in terms of other major centers such as Toronto Sick Kids, are they going through the same issues at the same extent?
Yeah, thanks for that question. And that's also part of the reason why every community needs to come together to do what we can to ensure we have capacity here, because this is happening across all of Ontario, across all of North America, and in much of the other parts of the world as well. So we are not alone, and yet at the same time, it means we can't rely on other communities to be able to have the resources at this time to help us.
Thank you. When you talked about sending kids other places, I was wondering, where would you send them to? It sounds like it's happening everywhere.
When it comes to critical care capacity for children in the province, it is quite limited, and we work very collaboratively with all of the centers. And so when there's a child that needs care that we can't provide care here, then we work collaboratively with our partners right across the province, and sometimes even beyond the province, to say who has the ability to care for this child. And it's very, very hard for the child and for their families, and we then transfer them to the center that is needed.
Thank you.
Thank you, Member Gower. Member El Shantiri.
Thank you, Mr. Chair. No question.
Vice Chair.
No questions for me. Thank you, Chair.
Member Cloutier.
Thank you, Chair. No questions.
Member Banham.
No questions. I just wanted to say thank you so much, Dr. Sampson, for all that you continue to do and for speaking today. I also want to thank CHEO for continuously being available for different partnerships and encouraging other vaccinations, like routine vaccinations that unfortunately, with our primary care access decreasing, there's been a lot of kiddos who have lacked the access to routine vaccination. And to throw in there Tdap vaccine in pregnancy and also COVID vaccinations in pregnancy, because we know that those help to protect those kiddos once they're on the outside. So just wanted to add those in here while I had the attention, and thank you so much for everything that you do.
Thank you, Dr. Sampson. I just have a quick question. I believe you're aware of the motion that the Vice Chair has introduced. Would you be supportive of this board voting in a positive way on that particular motion?
Yes, thank you for the question. I would be, and CHEO would be supportive of that.
Okay, thank you for that. I don't see any other questions, so thank you, Dr. Sampson, for taking time out of, I'm sure, a very busy day, maybe a very busy season. So we appreciate that very much. Thank you.
Thank you.
Next, we have a second individual by way of Zoom, and that is Greg McDougall. Are you with us, Mr. McDougall?
I am. Thank you. Can you hear me?
Yes, and I'll turn the mic over to you for the next 5 minutes. Thank you.
All right. Thank you. And yeah, I appreciate this opportunity. I am also speaking to the hospital crisis. I think it was in both June and September, I was also delegating and mentioned the same issue, specifically about trying to push for more masking, including mandates. One of the things I mentioned was the data from Alberta, where they had found that mask mandates in schools reduced the transmission of COVID by a factor of 3. So I think that's important to note. I know there is a lack of data in a lot of the places, but that was pretty solid data. I appreciate the delegation from the CHEO person, and also to mention just right beside them is a general hospital, and there was a worker from there on the weekend who was saying they're at 200% capacity in their ER. They're reassigning people left, right, and center, and their words were they are crashing, and they are crashing quickly. And I had heard also CHEO is sending people to the adult hospitals, but I mean, it's not just a child problem. And something that's important, I think, like over the summer, I was supporting the unions. They have demands of the government of how to fix the staffing problems. But it's a really good way to look at it. It's a supply and demand. So supply of services is what the hospitals can provide and the staff they have, and but the demand is how many people are going there. And like at CHEO, they're experiencing the very, very high volume. And I think the people are talking about immunity debt because the kids haven't had the viruses for a couple of years, they haven't been exposed to them. But I think what's the more compelling case hypothesis is the immunity damage, because so many kids have had COVID and now they're getting more severe cases of RSV, more severe cases of herpes, liver damage, because probably their immune systems are damaged. And there's been so much widespread infection of COVID. So I think the focus on preventing transmission of all these respiratory viruses is really important. And that's something that OPH can take a leadership role in, especially when the province hasn't been. I think we've seen that over the whole pandemic, that there is a need for greater step up, whatever jurisdiction it is. I think with respect to the motion, it sounds like it's intended well, but I think this, I think it displays the wrong focus when you talk about individual responsibility, that you want to educate the public to do their own thing and maybe wear masks. We're in a jurisdiction that's probably had the most severe cases of assault and harassment against people wearing masks, and we don't have any mask mandates right now. So I think that needs to be considered, is that there needs to be like public health leadership. Public health is like to create policies, not just encourage people. So that's why I think, again, we need to advocate for mask mandates, not suggestion. I mean, like people have been talking like they're on the LRT and they get Dr. Etch's voice, I think it was, over the intercom saying, we suggest you wear masks, or at least it's a public health PSA. And you've got like 2 people on the whole train wearing a mask. So there's this cognitive dissonance. I was in the public library in the washroom, and they have an OPH poster up, how to reduce transmission. It doesn't mention masks at all. It just says wash your hands, cough in your elbow, stuff like that. I was at a after school program, and there was a girl, maybe 8 or 9. The kids started talking about masks. The girl said, well, her dad's wearing one because he's sick now, but she's not sick. And within 2 minutes, she coughed like 3 times into her elbow without wearing a mask. So that's like where it is on the ground. And also, I know someone whose son is now in ICU with the flu or RSV or something, vaccinated for it, but still in there. So I think this like focus on, well, vaccines will protect us, well, let the public do their own thing will protect us is not good enough. And I think like we're in a huge crisis with the hospital crisis. So at what point will the public health people actually take appropriate action is my question. I think I'll leave it there. Thank you all for all the work that you do, and all the best for the people heading off to different directions. Thank you.
Thank you, Mr. McDougall. Again, we'll go through the list, see if there are any questions for the delegation. Member Tilley.
No questions.
Thank you. Member Pinnell.
No questions, thanks.
Member Menard.
Oh, thank you, Chair. Thanks to the delegation.
Member Lakin.
No questions, thank you.
Member Kavanaugh.
Thank you.
Member Gower.
No questions.
Member El Shantiri.
No question.
Vice Chair.
No questions.
Member Cloutier.
None, thank you.
And Member Banham.
No questions, thank you.
Okay. Thank you very much, sir, for coming out tonight. We appreciate the time and the discussion.
Thank you.
We'll now again go back to the list. If anybody has any questions for Dr. Etches on a verbal report, or questions or comments around the motion on the table currently. So again, we'll go to Member Tilley.
No questions, but an excellent submission to the Government of Canada on the legalization, regulation of cannabis. I thought it was really well done, and some great points in there. So congratulations to you and the team, Dr. Etches.
Thank you. Member Pinnell.
No questions. And again, thanks. And it was so good to read all what you've been telling us about, whether nutritious food, cannabis, and all of that. Thank you so very much. And I'd like to add another comment. Chair, I really enjoyed your words today, and I would like to repeat some of them, thanking Dr. Etches, thanking the team, thanking you, congratulating the new elected one, and thanking those who have decided to retire. I think that all of you together can make it that, yes, we've got a very amazing city being well taken care of. And I'm not talking anymore. Thanks.
Thank you very much. There's 3 of us here. I don't know if we're retiring, but we're not coming back to council. So we appreciate those words very much. Thank you. Member Lakin.
Thanks, Chair. Just a quick question regarding the motion for anyone who would like to respond. And the question is, has Ottawa Public Health or Dr. Etches received any request for guidance from any of the local boards, school boards, for recommendations regarding mask wearing?
I know our Ottawa Public Health team is in close contact with schools, school boards all the time. I'm not personally aware of any directors that have reached out to me for advice, but maybe Dominic Remner, would you like to comment?
Yeah, I think Nat Lair, who's actually the program manager, is available. So I will refer to her. Is she able to speak? No way.
Sure. Yeah, we can bring her in too. So I think if you're wondering if it's specifically on the topic of masking in schools, it might be. That is a subject that we really discussed together in the end of the last school year when mask mandates were lifted in schools and COVID was still circulating. So I think the approach is probably similar. And so the conversations, are there to take all the steps to be a mask-friendly environment and encourage mask use and encourage ventilation and infection prevention and control measures. That, if you're in it, do you want to say if the school boards have asked for any further guidance?
Hi everyone. Good night. Yeah, Barry, you said it all. So there was no additional requests from the school boards for guidance, as we're respecting the ministry guidance. We do instruct the same piece of ensuring that it is a mask-friendly environment this year, and there's been no issues thus far. And if there is any outbreaks, then we do our recommendations with the individual schools and assessments. Thank you.
Very much. Thank you, Member Menard.
Thank you very much, Chair. Thanks for your leadership, and to Dr. Etches for your leadership as well. I guess the one question I have is just around the resumption of full services that Ottawa Public Health has provided. And obviously there's been changes throughout the term based on priority setting. I would appreciate just an update on where those stand. I read some of the report, and obviously some changes that we had to make throughout were difficult in terms of servicing residents and some of the core functions. And just your thoughts around the resumption of some of those services in the future, and our posture going forward would be greatly appreciated.
So we still would say have the greatest gap in programming when it comes to chronic disease prevention and injury prevention, which is troubling because most of the burden of illness in our population is chronic disease. However, I know the team's being very thoughtful about how to have the best impact in preventing chronic disease. And so we're at the point of hearing from teams about how they propose we go forward with this type of programming. And I think there's interest in a couple of different ways of affecting change. Things like working with neighborhoods where the needs are greatest, working with our healthcare system partners to really increase prevention through other care providers, looking at policy levers that we have to think about how our communities are built, which I know you've supported as well, to make the active choice the easier choice. The food environment's important. So these are not things we've left behind, but we're really looking to implement new ways of doing them. We have a target date of March 2023 to be able to get back to more of that, just get through this winter season. We hope things will get better by March. And I think the other kinds of priorities that you've been concerned about around mental health and substance use health, those teams are getting back to the size they were before, certainly priority work. Some of our other services are still not quite where they were in terms of staffing, in terms of some of like our sexual health service. And where that's happened, we are really trying to focus again then on which are the populations that need to be served the most. And I think we're feeling positive about being able to get back to more work, but we see gaps in one of the reports before you that you carried talked about the need to do more on climate change. And so part of how we're going forward is to really assess where resources are allocated across the organization to make sure we address some of these gaps. And the other part highlighted for you is a real pressure is some of the infectious disease related work. The volumes from many illnesses, not just COVID, have increased, and the expectations for infection prevention and control have increased. And so we really need to think about that balance of creating a workforce that has a sustainable way of working. Just not asking too much of certain teams if the work has grown, but trying to right size. If that answers your question.
It does. Thank you so much, and happy to hear about the March 2023 date, and just always advocate for funding here, which helps with prevention and downstream effects and costs that we also incur in the future. So Ottawa Public Health is an important board to fund and entity to fund. When we look at the suite of options that the City Council has, there's not a lot of options for budget changes, but this is one that I think should take a bigger priority. So appreciate all your work and thanks for that update.
Thank you, Member Kavanagh.
Thank you very much. And again, I appreciate all the work that's been going on and the return to our core commitments of public health, which are incredibly important. And as you said, COVID is not over, as I experienced last month. It's still out there and it hits you hard. And we're lucky we have the vaccines, but there's still it's still not done. And yet we still have to get back to our core values. So I appreciate that. As well, I appreciate that report on cannabis products and the youth, particularly concerned about the vaping, and was glad that that was featured because it's still not over, and it leads to smoking as well. And I appreciate that focus. But yeah, so lots of work to do, and appreciate that. Thanks.
Member Gower.
Thank you. I have a couple of questions about the flu shot. One was, do you have any sense right now in Ottawa about the availability of appointments for flu shots and/or availability of the vaccine itself? Are there any challenges we're experiencing so far in this season?
So sometimes you hear early on in the season that it's difficult to access a flu shot because the distribution comes as a smaller supply at first from the federal to the provincial to the local level. So it's focused on populations at higher risk, like long-term care homes and retirement homes. But as of today, the current status, I think Marie-Claude would be best able to speak to that. Marie-Claude Turcotte.
Thank you, Dr. Etches. As of today, the general population is eligible from November 1st, anybody 6 months and over, and there is no issues with availability of the vaccine. There's enough vaccine for everyone who wants to get vaccinated.
Well, that's very good to hear. The other question, again, is about the flu vaccine. How is uptake of the vaccine tracked and reported?
It is tracked here at our clinics. We track the number of vaccines that are given at our clinics. We also track the number of doses that we distribute to all the healthcare providers here in Ottawa. And also there's a pharmacy distribution. So the pharmacies get the vaccine through a different way. They don't get it through us. They get it from their distributors. And this is also tracked how many they receive. And then from there, there's also a tracking on how many actually are given to residents in Ottawa. So we get that a few times during the season from our provincial colleagues in terms of how many have been given in Ottawa. We still haven't received a report on that, but we do get that periodically throughout the season.
Okay, thank you very much.
Member Elson-Cherry.
Thank you, Mr. Chair. And I'm not sure, Mr. Chair, is the Vice Chair moving this motion or you are? Who's moving this motion?
Vice Chair is moving the motion.
So I'm just wondering if we can have a friendly amendment to share that motion with the AMO, the Association Municipality of Ontario, for their support and also for their circulation to other municipality. Will you be subject to friendly amendment?
No, sorry, yes. I would not object to that friendly amendment.
Okay, thank you. You scared me at first. No one's okay, thank you. Thank you, Mr. Chair.
Thank you, Eli.
Are we sharing the motion or are we sharing the letter? Yeah, I'm just asking for.
Thank you, Mr. Chair.
Okay.
Thanks to the Vice Chair accepting friendly amendment.
Thank you. And Member Kuche.
Thank you, Chair. Thank you, Dr. Etches, for your report. No questions. Thank you.
And Member Banham.
Thank you. I do have a question, but I did also want to say thank you to the chair for presiding over this board. And I don't think any of us knew we were signing up, especially the community members, to be a pandemic era board, but I have been very profoundly proud to serve with you all and to be affiliated with Ottawa Public Health. And I feel like I've made so many new friends, from Darren to Esther, Mad Claude, all of you. And so thank you very much for all your work that you've done. The one thing that really struck me was the healthy food access and the price of healthy food. And I think we all understand that children, youth, families not having access to healthy food increases the risk further on of chronic diseases, of diabetes, all sorts of future costs. And so I guess I'm wondering, now that we've seen this increase, and I don't think it's a surprise to anybody who's gone grocery shopping lately, but now that we've seen that, are we going to get maybe some like a letter that we might, well, I guess the next board might be able to look at to talk about ways to combat food access issues for those who are most vulnerable?
Thank you for pointing out the importance of addressing this. In the report itself, it does talk about some of the measures that could assist with bringing an adequate income into, to address the need that is existing. And so I think maybe what we could do is bring this report forward to the next board so they can also take a look in terms of adequate levels of social assistance, guaranteed income, looking at tax measures and assisting people to fill taxes. There are a number of things that could be supported, so we could make them aware of this.
That's wonderful. And I know another way for at least the youth is school programs, which might be another provincial.
Yeah, and it's really actually work we do with our community and social services partners at the city as well. So maybe of interest to other councillors elect.
Wonderful. Thank you so much. And I'm sure the new board will benefit greatly from that. Thank you.
Thank you, everyone, for your questions, and thank you, Dr. Etches, for what will be the final report for this term. Informative always, and I know that a lot of work goes into those reports. There's a lot of team behind those reports, so I want to take this opportunity once again to thank the team that worked on this with Dr. Etches, and also the team that helped to build the motion that the vice chair is putting forward. I hope that we all support that motion. We heard from our CHEO delegate that would be helpful, and they're supportive of it. And I think the suggested amendment to share that with AMO, so more communities, more cities can get on board, is also very helpful. The other comment that I wanted to make, Dr. Etches, and kind of echoes what Member Tilley had to say about the work on the input on the cannabis update for the federal government. I think one of the things that was talked about, and every councillor sitting around this table, is the density of the shops. I don't think a week goes by when a councillor doesn't have it across his or her desk asking for, whether the approval is there or whether it's satisfactory for the community. One has to wonder how many more shops that we actually need in the community. And so I'm glad that the team picked that as one of the issues to raise concerns and provide dialogue about to the federal government. So seeing no further questions on the motion or comments, I don't know if the vice chair wants to do a bit of wrap up on the motion.
Yes, thank you, Chair. And actually, just to go back to to Dr. Etche's comments. It does seem like an eternity ago that the board approved the strategic plan. And what I've been most impressed with is really how OPH has been able to move forward with many of the items in the strategic plan, despite what we would never have thought was coming in the curveball. So thank you for that. And I think the reports that were submitted that we approved tonight are good examples of that, of really putting that long-term piece in place for the citizens of Ottawa. So thank you for that. And thank you, of course, Chair, for guiding us through this turbulent time. And also really do appreciate the emphasis that OPH always places on kids' health. We know that it's good in the short term to get kids on the right trajectory, and we know that it's good for the economy, for the workforce, for the future. It really is with our kids. And so really appreciated all that OPH has done to put hubs in high-risk areas, to work on vaccinations and well baby clinics and all of those things to really get kids and families on the right track. And so we appreciate this. And so really do appreciate OPH support for the motion that is being put forward tonight. It is, again, about rallying Ottawa. Ottawa always does see what needs to be done for kids and families, and really wearing masks, getting vaccinated, washing hands, and reinforcing all of those messages is really what we need to be curbing the spread of a multitude of viruses right now. And so really do appreciate that support in helping the healthcare system be there for the kids and families. So that's all for tonight. Thank you.
Okay, thank you. The only comment I'll make back is chair's only as good as the vice chair behind them. So thank you for the last 4 years. You've been a great support and very helpful. I think we vote on the motion first, though we also have to vote to accept the report. So we'll vote on the motion. Carried? Carried. And vote to receive the support, receive the report rather? Okay, thank you. We didn't hold the information previously distributed. We have no need to go in camera, as far as I know. Can I ask Member Cloutier to a motion to adopt reports, please?
Thank you, Chair. Il est résolu que le rapport verbal du président du conseil de santé, le rapport verbal de la médecin en chef de santé publique et les rapports intitulés Submission de santé publique Ottawa présentés au gouvernement du Canada quant à la législation et la réglementation du cannabis au Canada, Ontario Public Health Statements 2022 Activity Reports, Risk Management, Ontario Ministry of Health Accountability and Reporting Requirements, Q2 2022 Standard Activity Report, Ottawa Public Health Strategic Plan for 2019-2022, update from Q3 of 2022, Building a Healthier Ottawa, Ottawa Public Health Strategic Plan 2019-2022, end of term report be received and adopted.
Carried.
Carried.
Thank you. Are there any motions requiring suspension of the rules of procedure? Okay, thank you. It's your last chance. No? Okay. I don't think that we can't take any notices of motion. I don't think for the next meeting because we don't know who's going to be sitting around the table. Though I suspect maybe some familiar faces will be there again. Can I ask Member Cloutier to move the confirmation bylaw motion, please?
Thank you, Chair. Merci, Monsieur le Président. Be it resolved that confirmation bylaw 2022-6, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of November 7th, 2022 be read and passed.
Carried. Are there any inquiries? I think we can take inquiries going into the next term. Are there any inquiries? Seeing none. Going to adjourn. I just want to say again how amazing it has been to work with the people around this table for the last 4 years. Member Banham's right. I had absolutely no idea what it was going to be like agreeing to be chair of this board, but it truly has been a pleasure to work with all of you. Your hearts are all in the right place. The questions you've asked, the dialogue that you've encouraged, the role modeling that you've done about wearing masks and washing your hands and getting vaccinated and talking about your horrible COVID experiences. have all been extremely helpful to make our community aware of what public health is doing, what needs to be done, how we can all help each other. The team at OPH, I can't say anything. I don't know what to say. Just absolutely amazing. I can honestly say that, you know, it's been the highlight of my professional career to work with the team at OPH. I've never seen a group like them. No challenge is too much, no mountain is too high. The work that they do each and every day, the care and concern that they bring to the community, I don't know how to describe it. There's an energy, a positivity through some horrible times. There's always an openness to new ideas, an openness to work together, to collaborate. And at the bottom of it all is just this amazing amount of care, concern, and empathy for the people that they serve in the city. So from the bottom of my heart, thank you all so much for the work that you do every single day. It's very much appreciated. And we are adjourned. Picture.